Senate Democrats fine-tune their health care proposal, there's a new analysis that raises some questions about the exact cost of the plan that's already been passed by the House.
Our own Rich Adson, he's been following all the angles of this story in Washington. He joins us now with the latest wrinkle. Rich.
Well, congressional Democrats have proposed using hundreds of billions of dollars in cuts to Medicare to pay for their health care overhaul. That and questions about consequences of those cuts, the government-run plan, abortion language, and cost have all slowed the Democrats' progress. Senate Majority Leader Reid needs 60% of the Senate's approval to do almost anything, even to bring this bill to the full Senate to consider. So he's stuck. He's trying to keep the liberal members of his party happy while working out compromises to bring on a handful of moderate Democrats. And one analyst says the majority leader wants to avoid a summer town hall replay.
If Senator Reid introduces a bill before Thanksgiving, that bill will hang out there without the amendment process happening, without being able to change it. That bill will be turned into a piñata for anti-health care reform groups and people who just don't like the bill to beat the heck out of it.
Another setback for Democrats, a new government report showing their proposed cuts to Medicare will lead to benefits reductions for seniors and higher costs to the federal government, about $300 billion over 10 years. Democrats had argued the Medicare cuts would only slash waste from the system. Democrats were using those cuts to pay for nearly half of their health care overhaul. Now, if these cuts go through, lawmakers in the future would likely have to choose between the cutbacks for seniors or spending more money to prevent those service reductions. David and Liz, back to you.
Rich, thank you very much. As Rich just mentioned, the key action on health care is now focused in the Senate.
We are awaiting that plan to be released as this major piece of legislation is being crafted behind closed doors. So what's going on? Well, let's bring in Democratic Senator Ben Cardin of Maryland. Welcome, Senator. Thanks for coming on the program.
Good to be with you.
Can you give us any insight on what is going on behind closed doors as this bill is crafted?
Well, I can tell you that Senator Reid is very concerned to make sure that we do bring down the cost of health care and we do it in a fiscally responsible way.